Thank you very much, George, and welcome to everyone on this at this meeting. It's great that you've got everyone together to discuss this. I'm going to ask for my slides, and I'm just going to go through some slides and really welcome questions. So next slide, please. One of the interesting things was where I come from and what I saw as my remit in giving this talk. So I come as Chief Scientific Advisor, which is a role held in the Department of Health and Social Care, and importantly links with Chief Scientific Advisors in every government department, which is something I'll come back to later. As George mentioned, I'm an obstetrician. And so for me, this was a new area, not one I had delved into. And in preparing for this, it really shone a spotlight on the enormous amount of work that is going on, stimulated by the UKRI and by many others. And I felt that I could touch the surface of it, but really, as I went looking into it, made me realize how much there is how much there is and how much more we need to do. So I just want to reflect on some of what NIHR is doing and how NIHR and the Department of Health and Social Care would like to be very active partners in this. Next slide, please. So I sort of started by looking at where we are with NIHR and sort of trying to capture my role both in listening in order to hear from all of you and from my colleagues within DHSE and NIHR, but also then really thinking about how we translate that into actions. We heard from your hosts to begin with that COVID has been a challenge in this, and so to recognise the huge impact of COVID on older people and really to say this is the time to pick up the momentum again to bring the focus back to healthy aging, particularly in terms of tackling inequalities which have been magnified by the COVID pandemic and should bring us back to where the priorities really are. Next slide, please. So I think the trends in aging are well described, and if we go through the next and next again, the trends that we see, we all know what we're facing, and for me it's so important that we think about how we emphasize that quality, that healthy years of life, rather than just focusing on disease. As we say, it's a national health service and not a national disease service, but sometimes it feels as if there is a shift more towards the disease. And at a time when more than ever we've got a long waiting list and a long backlog, interestingly, one of the first jobs I did in my role was to look at the spending review, and it was really heartening that there is a major focus, both in the spending review and very much by the new Secretary of State in recognising the importance of preventative health. So it is, to come back to my theme, it's a question of how we see this translating into actions. Next slide, please. Along with the trends in aging, we are all aware of the geographical trends with the next two slide clicks, seeing that over 2029 and into 2039, we are seeing a shift towards a more rurally distributed population, particularly for those of 65 years and older. And again, we need to consider what this means for our provision of health and social care and how we address it with research priorities that best reflects this. Next slide, please. So there is absolutely no doubt that this is cross-sectoral. Recognising what UKRI are doing in this for the healthy aging and looking at how in the NIHR we excuse me, we are balancing this between addressing aging and addressing disease needs for those of older people. And this is where we are focusing at the moment, but this is evolving. And just thinking about how this looks like the sort of two sides of the same coin, but not the same. So just thinking about addressing disease in older people is not enough to say that that will tackle healthy aging. Next slide, please. So in terms of the priorities, it's we do try and achieve a balance in our portfolio between these two aspects. Next, please. So we've got work through the Policy Research Unit on older people. Frailty is included in there, but this needs to be as much about prevention of frailty as just addressing frailty once it exists. Next slide, please. Next click, thanks. So pleased to see that we've got work through the Public Health Research Programme on something that was touched on earlier, which is healthy extended working lives, and very much picking up on that from that great audio at the beginning, just to recognise that different people feel maybe very positive about extending their working life. And then also recognising the work through the School for Public Health Research, looking at their Ageing Well programme, next please, through a number of aspects, together with shared funding. For example, this is an active funding call looking at care and health at home through enabling independence. So all areas that we have got active at the moment. Next slide, please. So just to look a bit more about the Ageing Well, this is the School for Public Health Research, which is led by Professor Ashley Adamson, and has got several themes, including some that were mentioned earlier about age-friendly communities, the really crucial aspect of inequalities, particularly post-COVID, and looking at ageing and wellness. And they're using a four-stranded approach through areas such as risk prediction, understanding the evidence about what works currently, preventative interventions, and modelling that will help us understand the challenges better. Next slide, please. So I picked out some of these research highlights, which picks on the breadth and depth of the work from this group, and just thinking again about how we come back to this theme, that it's far bigger than a single sector in terms of health or social care, and that we really need to address how we make the cross-sectoral work happen, particularly across government. And this might be through working with colleagues in transport or DEFRA or BEIS, and just highlighting how wide the approach can be for this. Next slide, please. So I think what I've also gained a better understanding of is of the life course approach. In fact, I took this from a dementia prevention article. But again, it comes back to how we need to really be proactive in addressing these through childhood, young adult life, and not waiting till older life. And that's really to encourage all my colleagues, researcher colleagues, clinician colleagues, to think about what they can be doing early on, rather than picking up, when sort of too little, too late. And so this is really why the title is this challenge for all. And I think there we can see that there is much more that we could do in getting buy-in from an even larger community of researchers and practitioners. Next slide, please. So the 7 strategic focuses for the NIHR, which we published in Best Research for Best Health as the next chapter, all have elements that address this. So recovery from COVID, building capacity in preventative public health and social care research, which is crucial for this topic, understanding how we improve the lives of those with multiple long-term conditions proactively rather than reactively, ensuring we reach underserved regions, equality, diversity and inclusion, looking at how we strengthen careers for researchers in this area, and working with industry. Next slide, please. So we've really had 2 years unlike any that I've been involved in my medical career. I think that older people were at the heart of our response to this, particularly in coming forward for research, for example, for vaccines and treatments. And something to pick up on something Helena said, ageism must not happen in research. We don't gatekeep for who takes part, and we need to be truly inclusive, because that's what got us out of COVID, and that's what's going to be the key to the next years of research in this area. Next slide, please. So I think some of the Build Back Better plan is both about addressing how this happens for health and social care, and includes how we do this through the research ecosystem. Next slide, please. And not just, not as I say, not just in health and social care, but thinking about how we link both across the UK. This is a UK and much more global challenge, not just an England problem, and also thinking about how we link up with other departments. Next slide, please. So I moved to finishing by talking about the Chief Medical Officer's Health in Coastal Communities report, which really draws out many of the challenges, both the opportunities that exist with tackling these inequalities, but also acknowledging that we may need to think differently. This isn't a north-south divide. This is about deprivation at a quite a local level, and thinking about how those solutions match where the challenges are. Next, please. You'll all be aware of the newly minted Office for Health Improvement and Disparities, which is very much focusing on this, and this really runs as a strand through much of our work at the moment. Next slide, please. So I finish by saying this is a challenge for all. I started by thinking that as an obstetrician, that I wasn't well placed, but I'm now aware that as an obstetrician, maybe I'm best placed than many to say it starts at pregnancy and beyond. And in fact, thinking about some of the work that I'm doing to look at women with postnatal hypertension, to say that's our opportunity to intervene. So it's about making it relevant for all. And I think that this conference and this community are really well placed to do that. Thank you very much.